911, what's the address of your emergency?
Here at 911, we take an average of about 1 million calls per year. We serve all of Multnomah County, which includes Portland, Gresham, Troutdale, Fairview, Wood Village, Maywood Park, Sauvie Island, and unincorporated areas of Corbett. We have about 125 employees who answer both 911 and non-emergency calls, and also dispatch police, fire, medical, and Portland Street response. 911 is used for emergencies only, and you can now text 911 if you are unable to call. When you call 911, you speak to a dispatcher who has undergone months of training, and they learn to ask very specific questions so we can determine what kind of help a person needs. Know, though, that while we are talking, we are also getting help started, so keeping you on the line won't slow anything down. Let's see what it looks like taking a 911 call on our end.
911, what is the address of your emergency?
I think I need an ambulance right now to my house. I'm at 9902 Southeast Powell.
Okay, 9902 Southeast Powell Boulevard. And is that a house or apartment?
It's a house.
Okay, and who is the ambulance for? Is it for you or for someone else?
It's for my husband. He was changing a light bulb and he fell.
Okay, I'm going to get some help started for him. How old is he?
He's 58.
Okay, 5'8" or 58. I have a few basic questions first. Is he conscious right now, like awake?
He's awake, yeah.
Okay, and is he breathing normally?
Are you breathing okay? Yeah, he's breathing okay.
All right, and is he alert or confused as a result of the fall?
He's alert. He's just in a lot of pain.
Okay, and what is the location and type of injury?
I think he's mainly having hip pain. We have hardwood floors, and he fell pretty hard.
Okay, hip pain. And you said he fell from a slightly elevated distance. He was on a step ladder. How many steps up was he?
It was one of those 3-step ladders, so not huge, but he was reaching up, and then it all just collapsed.
Okay, and when did that happen? How many minutes ago?
Right before I called, so maybe like 2 minutes ago now.
Okay, and is he still down on the ground?
He is, yeah. I told him not to move.
Okay, good. Is he trapped or pinned?
No.
Okay. Is there any bleeding?
I don't see any bleeding.
Okay. And is the patient on blood thinners?
He's not.
Okay. So our pre-arrival instructions for you to give to him is we don't want him to move unless necessary. And we also want to keep his head and neck from turning. We never know if there's an injury underneath there. We don't want to put anything underneath his head or neck either, okay?
Okay, I can do that.
All right. And I do want to let you know I have some help started for you. What is your first and last name?
It's Chelsea Jones.
Okay, Chelsea Jones. And a phone number for you?
503-309-0724.
503-309-0724.
Yeah.
All right, and lastly, I have a few COVID questions we're required to ask. Do you guys have any known exposure to COVID-19?
No.
Okay, any fever, cough, shortness of breath, or diarrhea related to COVID?
No.
And any out-of-state travel within the past 30 days?
No, we haven't.
All right, so we ask all occupants there to wear face coverings while the crews are there. And if feasible, we ask the patient to meet outside. Now, you said he's still down. What we talked about earlier, to not move him, is more important than meeting outside for the crews. So just answer them when they come to the door, okay?
Okay, I'll run out there and meet them myself then, if that's okay.
Yep, that sounds great. And we're on the way. Just call us back if anything changes before we get there.
Okay, thank you so much.
You're welcome. Bye-bye.
Bye-bye.